And so welcome to our groups to join us from the various channels out there, and but proud to be here with you as part of this Well Wave Now panel discussion. And our leaders, of course, you've got Breck Rice, who is the healthcare disruptor, and also all things medication and guidance that way. And then Dr. Bob Levine, renowned brain researcher and expert in drug-free pain elimination. And I'm Tim Daniels, functioning as a wellness plan manager and also wellness technologist with a specialization in the great technology of pulse electromagnetic field therapy. But our purpose coming here as a group and with you here is to help kind of take America from a state of unhealthiness to help them get healthy, but also go beyond health to a state of wellness and well-being, which means you're thriving, incorporates performance, and goes beyond just the physical into the mental, and sometimes Dr. Bob takes us into the spiritual as well. So, so that's our purpose. And as part of that, we're always looking and glad for partners who are help us reach the audience, help us provide that information. And certainly a big part of that population, and I came to always respect it and love, but came to understand exactly how much they need that wellness and aging help, was the elderly. When I ran an in-home care agency for the elderly that operated in 3 states for approximately 8 years. And one entity that's partnered with us and done very well is Dennis Patuis and his group, delivering the Healthy Aging podcast. It was a radio show for a number of years, taking that into the future with podcasting and just delivering great and fantastic information out to the public and the resources. And so with that, I'd like to give Dennis, since he's such a great partner with us, a little bit of time to sort of talk about that Healthy Aging show.
Mention your name.
How are you? Thank you very much. Can you hear me?
Yes, we got
Okay.
loud.
Hi, guys. Thank you for having us, and we're happy to be part of this. Yes, we had a show on radio in Lower Connecticut for 7 years, Healthy Aging Show. We kind of forged podcasting before it had a name. We had posted everything to our website. And we did a number of shows, many of which are just as relevant today as they were then. And we started with dealing with people that were elderly and frail and realized that those weren't the goals that we were trying to achieve. And we wanted to be able to help people do it better. We never had an opportunity to live as long as we can today. Fortunately, medical science is helping us with it, whether we like it or not. The question is, how much of those additional years are going to be good years, as opposed to being in pain and being in need of help from others? So doing it better is our objective, and we're looking at all facets of the aging process, not just the health and medicine side, but having spent 20 years in the home care business, I've seen what I don't want to have happen to me. And a lot of what we talk about is what we look at in the mirror in the morning.
Yep.
We find things that are problematic and we say, gee, if it happens to us, it's got to happen to somebody else. So we have a podcast, we have a website with a lot of information. We're constantly putting up more information. I have Tim will be starring in a presentation role, question and answer on PEMF shortly. So
Dennis, hey Dennis, would you mind please providing your website URL so we can actually go to it and check it out? I'd really
absolutely.
like to do
We're great.
It is healthyagingshow.com.
All right, so healthyagingshow.com.
Right.
And where's your podcast found at, Dennis? I know you can see things.
Probably, well, you can go to the website,
Yep.
which is a great place to go, and we try to direct everybody there. Spotify,
Yep.
and all of the principal handling pages for podcasts.
All right. All right, appreciate it. So you're great work there. I can testify to what you've been doing for years, and I know it continues and expands and grows on that. Appreciate you being with us here and bringing your great colleague Don Del Greco as well on. And so it's fantastic to see you again, Don.
Same to say to you as well. Looking forward to learning a lot more of what you're talking about today. I'm excited about it.
I appreciate it. And so, what we're going to go into today, we were asked to kind of continue our discussion on hypertension, given people had some areas we did not get to, they wanted to have answered. We started on it, but also because of the importance of it out there, I think if I remember correctly, there's something there are a couple of estimates depending upon if it's CDC or the National Institute of Health, said there's somewhere between 112 to 120 million adults over the age of 20 that have hypertension, many of them going undiagnosed with it. And then many of them, even if they're diagnosed with it, not being to have it under control. And so giving all the damage that can do to an individual, even as we found out in a short period of time, like 6 months, we thought it was important to get back on that and help get the information out and answer questions and hopefully make some progress on that. So we're going to dive into that. But now as always, I guess Breck, if some questions come to you through TikTok, please let us know. People with us here on Zoom, if you'll plug that in as we go along, great. But if you've got anything that you want to say up front here that says, hey, this is what I came here for, this is what I'd like to get out of it, please feel free to comment on that now. Diana, anything you'd like us to focus on, or tell us what brought you here?
Can you hear me? I guess
Yes.
you can.
Yep.
Oh, okay. Well, this may be one of your topics, but the use of medical devices now. I know we know about lifestyle issues and medication, but the whole area of medical devices and how that's making inroads and breakthroughs in the whole area. If you're going to touch on that, that would be great.
Beautiful. Will do. Lana or Moshe, anything that you'd like to say?
No, I'm just interested in the topic. Thank you.
All right, great. Good to have you here with us. All right, so now one of the things now last week, and I'll take the blame for this. I'll always shoulder the blame these days. And last week I was so anxious to get in on the topic of hypertension and high blood pressure, and we rolled right into it. And a couple people afterwards said, well, did you expect me to understand really what hypertension is? And so define it for me. Make sure that we're talking about the same thing. So with that, I'm going to ask Dr. Bob to put us all on common ground here, if you would, Bob.
Okay, well, the definition, when we talk about hypertension, the definition is really quite simple. It's when the pressure in your blood vessels is too high. Now, there's two numbers that are important in blood pressure. There's the systolic number and the diastolic number. The systolic is the upper number, the highest pressure that is detectable when your heart is pumping, and there's the highest pressure of the blood going through the vessel. And then the lowest number, the lower number, the diastolic number, is the number when the heart is at rest after pumping. And then there's a measurement that happens at the low end of what the blood pressure is. That's called diastolic. So what's considered the normal range of blood pressure is when the systolic is 120 and the diastolic is 80. That would be considered the mean of if you had a bell curve, that would be the mean right in the middle. What's considered high, that'll depend on who you talk to. But I would say that most people refer to high blood pressure is too high when it's over 140 over 90, when it's higher than 140 over 90. And even that's probably getting pretty high up there. So that's when people want to pay attention to what's going on with them and and the problem with high blood pressure, which is why they call it the silent killer, is that the symptoms are very hard to sense. People don't sense when they have high blood pressure. I can tell you my personal experiences. Decades ago, I felt when I had my head on the pillow, I could feel my temple throbbing, and that told me something. But that's the only symptom that I could sense, and that's when I realized that I did have some high blood pressure. And of course, now I haven't had high blood pressure for many, many, many years. I haven't taken any medication for it. I figured out how to bring my blood pressure down through all the holistic health training that I participated in and the clients that I've treated and the clinical trials that I've run. So, but the bottom line is the symptoms are really hard for people to sense. And so that's why they call it the silent killer.
Right. And then I think oftentimes when people do experience symptoms, is after touches what you felt, and you were lucky in your case to catch earlier, but if they feel a little dizziness, if they feel some other things, they're trembling the hands and things of that nature, it's often gotten to the point where it's already done some damage in the body and starting to show up on that. But so part of that, so I think you touched upon it, Bob, a little bit of why it often goes undiagnosed, and it's because some of this is not, symptoms don't always trigger it out for us. But I think Breck, I think you have some other thoughts in terms of medication interactions and things that people are on that also contribute to that lack of knowledge of when it's actually happening. Right?
Yeah, absolutely. We always talk about on the scary drug facts, some of the side effects, but there are certain specific medications that actually contribute to raising your blood pressure that you need to be aware of. The NSAIDs, for instance. So your naproxens, ibuprofens, the non-steroidal anti-inflammatory drugs that you need to be aware of. Let me flip the screen around here so people, and welcome everyone that's joined us on TikTok. Thank you for joining us here as well. But wanted to talk more about some of those medications. Also, over-the-counter medications like cold and flu meds. Your decongestants are something that you need to be aware of. Can certainly elevate. Even birth control pills. So oral contraceptives can increase your blood pressure, so you need to be aware of that as well. And then, some autoimmune disease medications have been related to increasing or showing signs of having high blood pressure. So you need to be conscious of that if you're on an autoimmune medication. Antidepressants, a lot of the major brand names that you've heard of before, they all increase your blood pressure. So that needs to be monitored regularly if you're on an antidepressant. And even migraine medications, some cancer medication. Did you have a question, Tim?
No, was a comment more as one part of that. Well, I do. I'll turn it into a question, because I know you don't like my comments. Breck, going to give you. So, do doctors always catch it? How catch this? Do they bring it up in discussion that these are of all of these things that's a potential side effect of it?
Yeah, you wish that everyone would, right? Every medical provider. And I can speak from my own personal experience on being on a maintenance medication that worked great for me. It had nothing to do with blood pressure, totally different symptom for GERD or reflux or heartburn, basically, right? Really bad. And I was on a medication that worked beautifully, and I'd been on it for 2 or 3 years. And my provider never once told me about some of the things I should be aware of. And then when I needed to get my prescription filled, that provider wasn't available. And so the nurse practitioner at the clinic was available to see me. And the nurse practitioner was the one that said, "Hey, this is robbing your bone density, right? How long have you been on this?" And I'm like, "Man, I've been on it for 3 years." Ooh. She tells me, "You might think about doing something different, getting off of this, because you may have some problems with your calcium and your bone density." And sure enough, that very winter, I'm up snowboarding and blow out my ankle and have all kinds of problems. And man, it wasn't until the nurse practitioner that actually told me that. So that was my own personal experience. So I wish every provider. But then again, if you look at it from the industry of medications, your PharmDs or your pharmacists are the ones that have that major experience with pharmacology, where our MDs, they might have had a semester of pharmacology. That wasn't really the primary focus, is some of the drug indicators.
Right. And then it's so a great point there, and that sparked a thought in me. Another experience, similar experience I had is, you talk about the NSAIDs, and that's things like what the ibuprofen and things of that nature. They're very common. Sometimes you get prescribed, sometimes you take them over the counter. And I've been having a lot of dental work done over the past couple of years. And as part of that, they would always send me home or with a bottle, or have me get beforehand a bottle of the NSAIDs. And they didn't mention it. Or if I would tell my doctor every now and then that for my primary care, I would say now and then I take an NSAID for my knees, although I try to, old collegiate wrestler, ripped up knees from the sports industry, arthritis set in. So every now and then, if I want to get some relief in my PEMF device and something else isn't bringing up, would take an NSAID. Nobody had ever said to me, even though I'd often said there was a history of high blood pressure in my family. And I've gone to doctors over my life at Stanford University in the medical hospital there, University of Chicago hospital, Yale, so top ones in the country. And I got a very, very good primary care one, never mentioned it. It was a pharmacist when I went in there for a prescription earlier this year after some dental things, said, do you know I need to really be careful with these NSAIDs because they could trigger off high blood pressure in you. So that just, and then I never thought that. So even me that works on, been around the wellness industry and focused on it now for 17 years, I never even thought about that. So your pointer on always look at the medication and the interactions and possibility and have discussions on it is extremely, extremely key, I think.
Yeah, absolutely. And to just round off the list of other drug classes to be what we talked already about antidepressants, but also please remember the antipsychotics as well. So that's another class of drugs that has been known to really elevate your blood pressure. Even testosterone, if men's health, you need to be aware of that and monitor it if you're getting testosterone injections or creams or anything like that. Funny thing though, real quick, we finished. There's two other categories that are not on the prescription drug area.
I'm sorry, Rick. I was wondering if you were going to get on those because I was about to say, I know you're in Arizona where there's such clean living that it might not pop into your mind, but it looks like it. Maybe you went to visit Bob in Florida and something.
Yeah. Well, we'll take two different areas of Arizona. I don't know if anyone's ever had the privilege of being up in Sedona. That's more of the holistic natural approach, and there are actual herbal supplements that you need to be aware of that can increase your blood pressure. Ginseng, licorice root, those are all very popular supplements. They can elevate your blood pressure. Now to what I think you were alluding to, if I were down in Florida, maybe South Florida, Miami area, that's the illicit stimulants, right? It's the things that we probably shouldn't be messing around with anything anyway, but obviously, meth and cocaine are going to definitely elevate your heart rate as well as your blood pressure.
Okay, good. Now, some of those cases, you got to take some, if you really sense it and feel it hitting you a little bit, you got to take some immediate action to try and bring that blood pressure down. I know, and then Bob, I know you talked earlier, I forget what it was, 140 over something. It's really out of consider that high, but both in your own terms, I'll stop making it too much of a leading question. When do you think it's really critical to take action? And within that sort of thinking, when might you and not might you want to say, look, I got to take a drug for a while to do something?
Well, personally, I think when your blood pressure gets sustainably over like 150 or 160, over 110, 120, it's probably time to take some urgent action to use some pharmaceutical to bring the blood pressure down, because high blood pressure increases the risk of heart attack and stroke in a big way. Because when there's so much pressure in the cardiovascular system is a closed system. So anything that clamps down on the system, for instance, I talked last week about excess neuromuscular contraction where you can contract all your peripheral, skeletal muscles, and you can have your blood pressure go through the roof, which is why I always teach effective muscle release routines so we can relieve the pressure on the blood vessel. But when you have this high pressure in the circulatory system, the heart has to pump harder to get the blood through the system, and the lower, and of course you have the possibility of stroke too, because you got this high blood pressure going up into the brain. So it's really worthwhile to intervene it really work with your physician to get the advice. My advice is non-medical. It's just my opinion, but I think, 160, 170, 180 over 110, 120, 130, you really got to start doing something so you take the medication to help bring the pressure down to a better range while we do other things. Because I don't think anybody on the planet wants to be on long-term pharmaceuticals because of potential long-term side effects and things like that. So pharmaceuticals, in my opinion, as a PhD in pharmacology, should be used as temporary aids to help rebalance the human condition when at all possible, right? So that's what I think. And then while the blood pressure is brought down by the meds, then you have to it's worthwhile trying a lot of other things. And Diana brought up about devices. There's a device called Respiret, and that basically is a device where you wear a band around your belly and you make an effort it tells you when to inhale and when to exhale. So the effort is to slow your breathing down and deepen your breathing. And that apparently has been shown to be effective. So, and there's other devices that are out there. I mean, in my opinion, I think people need to be trained to slow their breathing down and deepen their breathing. And that's something that we can all train ourselves to do. So, it's not, if you need a device to help train yourself, great. It's like using a pharmaceutical in the short term. You use the pharmaceutical as an aid, and then you do some other things to help get your blood pressure down. And it's really important to monitor blood pressure when you're doing other things. I told a story last week about I had a woman who was uncontrolled at 145 over 95, fully medicated. And when she did our program, which involves a lot of guided meditation for relaxation, breathing, and effective muscle release to release the pressure on the cardiovascular vessel, she basically went down to 90 over 60 and needed to get a blood pressure, the pharmaceutical adjustment quickly so she didn't hurt herself in the short term. Go ahead, Tim.
Yeah, so you can understand you've taken people who have been here before through the muscle relief, and you explained it again for those who are just joining us on TikTok, where as a reminder there, we're talking about hypertension and how to impact it and how to bring it down a little bit here. The deep breathing you were talking about, do you see that as stress relieving? It triggers bringing the blood pressure down? Does it trigger other chemical release in the body? What's the benefit and that impact of the breathing you're talking about?
Well, when breathing is relaxation, breathing is de-stressing. All change to me starts with adjusting the breath. So that's just my philosophy about that. So I teach people proper breathing techniques and how to use the breath as a trigger to make changes, really fast changes, which is important. Stress obviously is going to impact blood pressure. Stress increases neuromuscular contraction. People who get stressed, they get tense, their muscles are in contraction. They don't even know it most of the time. And then those muscles are compressing down on the small capillaries and small blood vessels and creating a high pressure situation, which makes the heart have to pump harder to get the blood through the system. And when you measure the diastolic, the lower number, and that number is 90, 100, 110, that is dangerous, because that means that those vessels are really getting compressed and it's hard to get the blood through. So you asked about effective muscle release. That's a way of retraining the muscles to go from excess contraction to relaxation release. And then when those muscles let go, the blood vessels open up, the blood can flow more freely. So that's one of the many factors that lead into high blood pressure.
Yeah, so you covered quite a bit in those last few minutes. So I'll try and make a few comments, and and then we'll get to Moshe, who's got his hand raised, has right there. One, like we talked about, like you said, your advice and good advice to work with your doctor on when they see is really needed. But we get back to that earlier discussion, and so much goes undiagnosed, and so many, and it's unsymptomatic. And so many people are only going in and getting their blood pressure checked, once a year at their physical exam. If they've got some other going on, they might be going a couple times a year. For how widespread this is and how impactful it is and how impactful it can be in such a short period of time, that's where I think, we talked about a little bit before, but want to reiterate people really ought to, in my opinion, invest in a home monitor. And that's what I do and encourage my wellness plan management people, where I serve as kind of a general contractor across their health. It's $60. I've got a very good one that I made sure is accurate when I went into the doctor and compared what was taken there against what I have. And you should do that once a year to make sure you recalibrate it. But for $60, you can monitor your blood pressure at home. It'll also check your pulse. I think there are ones that are even also going the oxygen levels in the blood. I didn't do that. But, and what I encourage and advocate when you first get one is to take it every day for 2 weeks, sometimes twice a day. I know, Bob, sometimes you say 3 times a day at number one and number two.
No. I want to make a correction. When I take it once, and then I wait 1 minute or so. I take it again. If it's identical, then I'm satisfied. If it's way different, I'm going to take it a third time.
I wasn't going to misquote you, Bob. I did say 3 times a day. I said 3 times, but I meant 3 times in a row. But I was going to add your philosophy on that. So, but on that, maybe
sorry to interrupt you. Then
twice if they're close enough. I stay with that. But anyway, when you first get one, I advocate taking it every day for 2 weeks. Get yourself a baseline so you know, are you in good blood pressure? What is blood pressure for? Even if you're over, because that gives you your baseline, so you know if the actions you take can impact them. And then now after that, I take mine 2 to 3 times per week just to see if there's been any changes on that. And that's good for blood pressure and hypertension, but also other diseases. There's a reason why doctors check it every time you go in, because there are kidney diseases and other things that impact blood pressure and feed on that. So it can be an early warning sign for other conditions. So that's why I like that. Number 2, we talked about, when you also mentioned, well, I'll go to Moshe, and Breck and Bob, help me remember, if you would, about communication to doctors, which also came up on that. But Moshe, if you would go ahead and ask your question.
Sure. 2 questions. First, I was hoping you just anticipated one of them. It was please explain the relationship between high blood pressure and kidney disease. That was the first question. Second one is when you talk about the different monitors, one of the problems I had in the past with the blood pressure monitor was the fact that if you don't, maybe they're more sophisticated now, but in the past, if you didn't have your arm in the right position, you didn't get accurate readings. And I remember having one where I was so frustrated, I used a phrase with the second word being "it," and throwing it against the wall and saying, "I think I have lower blood pressure if I don't use this POS." then using
some of that, a couple of syndromes there as well. But yeah, so talk about a little bit. So yes, and that kidney can be bidirectional motion. Sometimes the high blood pressure can cause damage to the kidneys. And so that'll throw it into it. That's one of the impacts. But also if you've got a kidney disease or something else, then yes, that can impact the blood pressure. So that's why it's key to monitor on both things. Then in terms of the device, maybe they've gotten less sensitive, but it's still key, because it's even key if you notice when you go in and your doctor takes it, how they ask you to sit, how they ask you to place your arm, how they place it around the arm. Yes, you do have to work with that, even with the other monitors, but it's well worth it to do it on that one. So on the communication part, where Bob, I think is key, is when you mentioned nobody wants to be on medication long term because of the potential side effects and other things. Where communication come in is something we talked about a few episodes ago. And one, if you follow Breck on TikTok and you look at his profile, you can go see where get the past episodes or discussions with us, so I encourage you to do that. One, we talked about how do you have effective communication with your healthcare providers. Unless you bring it up to saying, I don't want to be on this medication long term, it's not likely to be a point of discussion. So you got to bring it up and talk to them about how can we work together on that? What are things I can do to do that? And say how and work out a plan with that healthcare provider. Take proactive, research it yourself a little bit, and have that communication and dialogue with your primary care provider to make sure that happens a little bit. Okay.
Yeah, the question I would ask anybody who's on medication that they would rather not be on, I would ask the question every time I saw any healthcare provider, physician or otherwise, what, in your opinion, do I have to do, or what changes I have to make in my life so that I can ultimately get off this medication? I would ask that every time.
Yeah.
Gather opinions about that. Go ahead, Breck.
Yeah, I was just going to mention, if anyone has followed any of my content at all, you'll hear me always say that, we do a wonderful job with acute care, acute situations, right? We can take care of infections right now. We can set broken bones really well in our current Western healthcare, but where we really kind of fall down is on the chronic care, because we try to just fix everything with the medication. And so that mindset and that training, unfortunately for a lot of our medical providers, are to just put somebody on a maintenance drug and then you're done with it. We move on to more acute situations. Well, you have to speak up. You are your very best advocate to your providers, and let them know I'm okay using this for a period of time to get things in line. But then what is the program for long term? Because that's not what medications are good at, is taking care of long-term issues. In most cases, there's a few exceptions.
Okay, great. I know, Bob, you had your hand up, but I've also a couple of hands up in the audience I want to get to. So if you could hold that thought, and to the TikTok people and the people on Zoom with us and other channels, we say we go for a half hour here and we try to get good information on that half hour, but then we make ourselves available for a second half hour, for the most part, to answer questions, continue the dialogue if there's interest there. So with that, now Dennis had his hand up and took it down. But Dennis, if you still have a question, please put the hand back up. But right now, I'll go ahead and go to Moshe. Go ahead, Moshe.
Since so much discussion has been about the effects of it or trying to get off of it, and I'm one who does take blood pressure medicine, how much of a role should a naturopath play in the process of the overall medical situation?
I would say, if you want a naturopath as part of your team, go for it. If you have the same questions should be asked of every practitioner. I'm on this medication. What changes do I have to make in my life so that I can ultimately get off this medication? That's what I say. And then the second point I wanted to bring up was the words drug holiday. Everybody on the planet should know what a drug holiday is. And that's where you work with your physician or provider, whoever's prescribing your pharmaceuticals. You work with that practitioner to wean off in an appropriate way the pharmaceutical you've been taking, to see where your whole being is after you come off of it. Maybe you don't need it anymore. So that's the key. Drug holiday. Just remember that. What changes do I have to make, and can we do a drug holiday at some point to test the ability for me to get off the drug?
Now, Moshe, if you ask that same question to a functional medicine person, they're going to say 100% of the time, right? You should be including functional medicine.
Well, medicine's become the equivalent of when you buy a copy machine. They make their money not on the copy machine, but the toner and other replaceable parts that you need to, cartridges, whatever, that you have to continue to purchase to keep the machine running. And medicine has become that disposable aspect that we have to continue to purchase to keep ourselves running the way the pharmaceutical companies have us set up. But my question was more looking at supplements as a substitute for some of the medicines. When I mentioned naturopath, I wasn't, at least in my mind, being naive enough to think that I can just go off everything and continue to function. So
Right.
it was in
do
that
you-
context I was referring to, working with the doctors and how effective is that nowadays? And I guess it was more just Dr. Bob.
Now, do you have, Moshe, you have a naturopath you work with currently?
I have access to it. So, I do work with a nutritionist, someone who actually was in the pharmaceutical industry years ago and has his own place. In fact, what I do is when I go for blood work, I actually show it to this person prior to seeing the doctor
Mhm.
to get his suggestion. In this case, it's a he, to get his suggestions of what I ought to consider when I visit a doctor, and then I'll buy the product and unopened and then get their opinion. If they go along with it, then I can try to change. If they don't, then of course I'll defer to the doctor at that time.
Right. And so that's how you describe that, Moshe, is kind of what I would suggest and recommend, and how I work with my clients in the wellness plan management, and how I work with myself. I personally don't use a naturopath. I selected and screened my primary care person to have both. She's very good. I call her a blend of conventional, integrative, and complementary. So I'll rely on her on that. But the way you describe that, working in naturopath is what I would do. I like conventional medicine. People have saved me a number of times. So I like them, but I look for the ones I consider kind of enlightened and who stay current. And then, yes, I would say, but naturopaths do have something to contribute. Other providers do as well. And so, yes, I get their counsel, get their thoughts, but I want to have that great communication with my conventional provider, for lack of a better term, and really get their opinion and then help them management. Because in my opinion, they know the most about medication. They know the most about what medication can and cannot do for you and to you. You have to sometimes pull it out of them, but I want to work very closely with them on making that happen. Bob, did you have something you want to add before we go to Dennis?
Yeah, maybe my views could be considered kind of radical, but I look to solve these problems, these issues, these ill health issues, without needing either a pharmaceutical or a natural supplement. I consider all of those to a certain extent band-aids. Maybe some of the natural supplements are better than the pharmaceuticals that could be. However, our goal is to reduce the pressure in the closed system. So if I'm taking a natural substance to relieve the pressure, I'm taking a diuretic to pee more, to get more water out of my system to relieve the pressure in the vessel. What's the difference? The difference, what do I have to do to relieve the pressure in the vessel? So I just want to say one thing. Almost all stress is based in language and communication. It's the language of thought, the stressful thoughts that somebody might have, or the interpersonal communication, which generates stress for a lot of people. And so to me, that's why I always include language-based training and communication training, because I want people to be able to interrupt their automatic reactions when they get aggravated, when they get stressed, because that's a big effect on the pressure vessel. So there's a lot of ways to go before we start taking pharmaceuticals and before we start taking natural supplements. So
yeah, I agree. We also we talked. I would say what you talked about was radical there. I think it can be done in certain circumstances. We also did talk though, a little bit when you're at X level, did you do medication and work off on that? I also would say some natural ones are okay. We really didn't talk about how do you relieve that. And we still want to get in that a little bit, our techniques for really relieving that blood pressure. But sometimes garlic can work, and there's nothing wrong with garlic. There's nitric oxide. You can get nitric oxide through beets. So there are a number of natural things that maybe should be part of I forget who first said it, but it's one of those, I think one of the ancient Greeks, but the name escapes me, said, let food be your medicine, right? And so there is good natural food that you can take that's healthy as part of a healthy diet that can address those things that a naturopath or others could help with. Dennis, if you would.
by the way, while we're waiting, there was Hippocrates who said that.
There you go. There you go.
Can you hear me?
Yes, sure can, Dennis.
I had a tool that I've been using, and I would be interested to see how you guys feel about this. Everybody's become more accustomed to AI. And I take a lot of supplements. I take a few prescriptions, and wanting to know how they work with or against one another is something that I've done on numerous occasions, and loading in information about what I take and asking pointed questions about conflict, interactions.
Yeah.
Should I be taking them all at the same time? Should I be taking them spread during the day? What's going to conflict with sleep? What's going to raise my blood pressure? And it's an interesting response. And given the fact that AI is still very young, and still it regurgitates information that may not be factual, but you have to take it and challenge it. But it's a way of getting more information that you either can act upon or you can use to go to see your doctor and discuss with them.
Yeah. Yeah, Brack is ready to respond to that.
I know, I saw him.
Yeah, I applaud you first off that you would, take that time to actually look at those interactions, right? Because when drug studies are done, and Dr. Bob will tell you this, he practiced that for 20 years. They're done just on that one individual medication all by itself. They never look at what other medications may be introduced into the bloodstream at the same time as a medication. So those drug-drug interactions are so key. Your pharmacist is a great resource for that too, right? That's what they're educated on. I'll take it one step further, and that is pharmacogenomics, a PGX test. They're coming down in cost now, and in fact, Medicare will cover it in most cases now, and other insurances are now jumping on board to cover those pharmacogenomics tests, literally looking at your own personal DNA, your genetic makeup. So beyond the drug-drug interaction, it actually will tell you, based on your genetic makeup, how you are properly metabolizing certain medications. And it will tell you, all right, you're okay. These medications are okay for you. They're in green. These ones are in yellow, proceed with caution, and then red, these ones may kill you. So it's really valuable information if you think about that last category, right? There are certain medications that really could be harmful to you. And so pharmacogenomics is absolutely, I'm a huge proponent for PGX.
I just had to add one comment, if you don't mind.
Sure.
So, Dennis, you're a great guinea pig. Almost every human being on the planet who takes any kind of medication is a guinea pig, because what Breck said is accurate. The drugs are tested, by themselves, one at a time. The instant you combine drug A with drug B and drug A with drug B and C, you no longer have evidence basis, zero evidence basis. So almost all of clinical pharmacology is based on no evidence. I have to say that, and I'll say that to anybody.
In the past, I've read that drug testing within the pharmaceutical industry is done during business hours, not nights and weekends, and as you said, not with other things, and as a result, you're not getting what's going on nighttime, and one of the things that I found out is the cyclical nature of some diseases. Some of them are nocturnal, and drugs should be taken at night and perform the greatest benefit, as opposed to wasting them during the daytime or wasting them with other things that just wash away when you go to the bathroom.
Yeah.
So it's important, and I've often wondered whether there was any way other than through the PGE that you've just mentioned, Breck, to be able to figure out how best to take them. I am lazy, so I take them by the handful, because I don't remember to do them later on. And I know that I'm probably spending more on life extension and the like than I need to. But you know, how do you know what to take with food? How do you know what not to take? How do you know what to take together? And you know, it's making the drug industry or the supplement industry a lot of money, and we're not getting the best benefit for it. And I think AI is probably one way that we can make the system learn for us.
Yeah.
How we can adapt to supplementation.
Yeah, there's definitely some exciting things coming with AI. We use a tool at the wellness centers that looks at blood markers. And so based on 118 different blood markers, we can literally predict through using artificial intelligence what those diseases might come from those deficiencies. So make the correction now before it turns into heart disease down the road or high blood pressure or diabetes.
Right.
Bernard's had his hand up for a while.
Yeah. So Bernard, thank you for being very patient. You know, let's go ahead and ask your question or make your comment if you would, Bernard.
You all brought up a great topic last week, and I wanted to see if you all wanted to kind of dive back into the conversation around the dysfunctional family behavior, inheritance, and I found that very interesting, and I wanted to you all to kind of all dive back into that and how that relates to the topic that we're on.
Yeah, Bob's ready to go. He's ready to dive head first into it. Go ahead, Bob.
I love, I mean, I coined for myself, I don't know, somebody else probably coined it way before me, but you know, with all the genetic inheritance business, and I used to be a big fan of straight genetic inheritance, but then when we started finding out that, well, the genes can be, you can affect genetic expression in progeny and offspring, and the genes can express differently based on what's going on from the environment, right? So that started getting me thinking. And then I realized when I started getting in all my holism and holistic health and chronic pain relief and just, you know, making changes in lifestyle, et cetera, I started realizing that, you know, I call it behavioral inheritance. So, you know, everybody in the family, the nuclear family, sits around the table, they eat together. Sometimes they walk together. I've seen kids walking next to one of the parents, and they walk exactly dysfunctionally like the parent walks dysfunctionally, which is why I like to teach proper walking. I actually love to teach that. I've had people walk their way out of high blood pressure simply by learning how to walk properly. Doesn't happen all the time, but it's a strong component for it. I explained that the last time. Yeah, so much, anything we pick up from our family is I would call behavioral inheritance. Like my father was he had explosive anger. Wonderful man. I loved him. He loved all of his kids. It's just that he had an automatic pattern reaction of explosive anger. So he would try and hold it in and hold it in and hold it in. It would just blow. He would blow. And my older brother was the same way. And my younger brother did not inherit that. He inherited the quiet. He would never explode ever. He made sure that never happened. And I was somewhere in the middle. And took me years to learn how to not, when you get to that point where that fuse goes, not to let it rip. So I don't know. So you know what I mean, Bernard, about behavioral inheritance? So much comes from being in the family and or learning from whoever, inheriting behavior from whoever you're hanging out with as a child.
Right. See, now I'll go with you, Bob, but I agree somewhat. But you know,
Somewhat.
also that there are, and I don't know if I wouldn't necessarily call them special children, but there, because then I'd be calling myself special. I had very great parents, loved them, fantastic, wouldn't change them. But there are some things that they said or did, and I see how they impact each other, that I looked at and said, I'm not going to do that. So I think you can, I think depending upon I think maybe, you know, you say maybe your brother inherited the quietness. Maybe he saw it and he said, I'm going to do that. Maybe he learned from it differently and said, I'm going to do the opposite. I'm not going to let that come in.
But Tim, before you keep going, I wanted to hop on what Dr. Levine was talking about. I'm not necessarily talking about the people who have the ability to not inherit it. I'm talking about for those who don't have that ability,
Yeah,
What is that path
I
connected
know,
to
I
the
know where you're headed,
stress?
but Bernard, well, I understand that, Bernard, appreciate that, from the comment on that, but I also did want to give the other side of it, that there is the and there's an opportunity when you work with those if you work with those young people, if you work with people in the family, to say you don't have to inherit, you can use the bad example to be different, you can use the good example, be the same way, but yes, what Bob's going to, what you're talking about, you can inherit dysfunction. You got to recognize that. It can be dealt with, but it doesn't have to be.
Well,
Right, right.
so I just have to comment on your comment, Tim.
Go
which
ahead.
which is it's when my older brother, he's an explosive anger, he blew all the time. He could never stop that. With his kids, with his wife, it was unfortunate, and he has survived that. He's still that way. My younger brother, on the other hand, went really quiet, right? And he could get angry, but you would not know he was angry because it was so quiet, And but the other thing is that, and this is addressing what Bernard brought up. My younger brother, it was a reaction to the father.
Yeah.
So it's still a reaction. It's the way and so I don't believe either way is a great way or the optimal way, Bernard. I believe that it's a matter of interrupting the pattern, right? That's why I talk about my automatic pattern recognition and interruption system. Be able to interrupt it like that. As soon as you interrupt the pattern, you're free of it completely until
And that's what I want to do. That's what I wanted you all to dive a little bit more into. It's more so around, I guess, being straight up. Is it strictly surrounded around it being inherited, high blood pressure and other things like that, or can you combat that? Always is my question.
Let me comment. Then Bob, I want to go back to you, and then Bernard added that part about always. It's a question. And I think that, to me, that varies about what you're talking about. If there's behavior, I don't believe that someone is genetically engineered or can behaviorally inherit murder and not be stopped from that. I believe that there are some medical things, and maybe high blood pressure depends on the source. There are some medical things that it's very, very tough to avoid and not triggering their Huntington's disease, for example, on that. So I think we got to be careful when we say always are not triggered that way. But I think but Bob, I'll let you answer for yourself on the other part. My opinion is, that's part of what we're talking about with interrupting. And I want you to go beyond just interrupting. Will one interruption start it, and how do you continually interrupt it so it doesn't come back? But do talk of that, say that's kind of your purpose, is saying you don't have to, and that was my earlier comment, you don't have to inherit that. It doesn't have to manifest itself, that behavior.
Yeah. Here's what I would say about that.
Comment as well.
Breck, you got something?
Yeah, no, I was just going to mention that, it's habits, right? The same thing has to do with, like, if you're inheriting a habit of having, anger issues because your father had anger issues. What about also the eating habits? Because you sat at the same dinner table, right?
Yeah.
You learned how to fix meals that your mom always fixed or your dad always fixed, and you continue that on. And so, those interruptions go way beyond, interrupting a pattern. It's interrupting a habit. It's interrupting a way that you learned how to do something specific, and now relearning it, and learned how to walk, and you have improper walking practices, to your point.
Yeah, absolutely. Well, what I wanted to say about automatic pattern, Bernard, I take it you're really interested, like I am, in this automatic pattern recognition and interruption system. So, if somebody, let's just say explosive anger or immediate stress reaction or fear, whatever the pattern is, if it's recognized and within 2 seconds it can be interrupted, you can have 120 incidents of automatic pattern expression, right? And if you can interrupt in 2 seconds, that's 240 seconds that we spend in one day, which is 4 minutes in one day, being in an automatic pattern, whatever it is, anger, fear, withdrawal, stress, whatever the pattern is. And then the rest of the time we're free, absolutely free. So it's a matter of how fast can we recognize it and how fast can we interrupt it. And so that's what I train people to do. And that's what's important. I think this should be taught in schools because, we got to teach kids at a young age that they can make all kinds of changes if they want to, and they can, and they don't have to be stuck in whatever environment they're stuck in, learning things and about themselves where they start. Every child I've ever run into, every child, including myself, had a deep, low self-esteem as a young person, me included. I mean, I think every child goes through that because, and so the words that I say parents should eliminate that I was not able to completely, but you eliminate the word no, eliminate the word don't, eliminate the words, why or why not, or how could you, or, what's wrong with you. Those expressions out of frustration that a parent says to the kid, it beats up the kid and the kid thinks there's something wrong with them. So every kid I've ever run into feels that way.
I'll comment on that Brett comment. You should have grown up in my neighborhood, Bob. We all had an overinflated sense of ourselves, including me.
That's an automatic pattern reaction.
Mine was very, very,
low self-esteem. I promise you, man.
Mine was very, very overinflated about myself. And, in fact, my dad got called on it a couple of times because one guy says, "This Tim is so arrogant. He won't even get out of his car when he comes to the gas station here, and that's why I'm not going out to fill it out." I really and that's the way it was in my neighborhood, Bob. But Brett,
they're the automatic patterns interacting with the automatic patterns.
Only comment I was going to make is about the other influences, right? It's breaking of bad habits can also include, even though you may have been raised on the healthiest, whole food diet and everything, that individual still has the opportunity to go and interrupt that good nutrition by, supplementing it with something like picking up a bad habit like chewing tobacco or smoking, right?
there you go.
Or drinking sodas, the sugary sodas,
Yeah. So you can move to New York where they're going to outlaw sugar. So
there you go.
Bernard.
So those things you talk about, the inherit, some of the inherited stuff. I want to bring it back to hypertension a little bit here. So yes, that bad fooding you can pick up, the tension you can pick up, and yes, that it can address hypertension. Now, I'd be remiss, now this goes into Diana's way, and I thought you were going to come out on my side earlier today, but then you got into this breathing device type of thing. I thought you were going to say, a beautiful, I got down this path with Diana, a beautiful contribution to help you get down even when you have high blood pressure on the short term, certainly help to work that baseline is the use of PEMF.
Yeah.
And now, Bob, why does PEMF help?
Yeah, so PEMF is a phenomenal device because it's so great. You just lie on it and twice a day. And what it does is that it allows the blood to flow more freely through the blood vessels. So instead of being sludged, like sludge, it flows freely. The blood vessels are opening up a little bit. So that's a great contributor from a device standpoint to help deal with blood pressure. And thank you, Tim, for pointing that out because it's a phenomenal device. I wanted to ask Bernard. Bernard, did I address your question? Did you feel like you got your question answered, or at least
I did. And because when you go into the doctor, oftentimes they do want to know that family history, and based off that family history, they respond a specific type of way, or at least that's what I think. And so that was where my question was going. Is some things just inherited? If you're doing specific things, could you be more guaranteed to receive that issue as compared to somebody else who it's not in his family, or is it totally connected to kind of breaking a habit, habits? So you all answer my questions in many different ways. And I appreciate you all's feedback.
Yeah, thanks for your questions, Bernard.
Then Don has her hand up. Get to Don real quickly. Breck, there's a question for you in the chat that says, I don't know if you saw it. I think you just saw it. Give it the full title of that PGE test and maybe how they can access it. Don, if you would.
Quick question. Well, maybe not a quick question.
And I got to hold
I got
on.
two questions, actually.
Well,
One is,
let me interrupt you for just a second. I
sure,
introduced Don earlier. I've known Don now probably off and on for 15 years.
yeah,
Just a fabulous person in the health and wellness world, fabulous person in general, dynamic. Pleasure to have her here with us. Dennis ought to be so happy that he partnered up with her that he ought to throw her a party every day.
He does.
I'm sending him a check again today for that kind. Thank you, Tim. That's so kind of you. And it's been such a great journey of always more to learn. So if you're curious, which I am, it's extremely helpful. But my question for you with the blood pressure spikes, sleep apnea, are there, yeah, I know. Unfortunately, I have qualified. But that type of I have a normal blood pressure during the day, unless some people talk to me, and then I have a higher blood pressure.
That's what I said,
Is
communication.
Dennis in that camp?
And then there's like after swimming, almost dead. But are there other compatible relationships with with hypertension? Obviously, sleep apnea's event is a spike, which is dangerous. But are there other combinations in addition to the kidney situation as well?
Well, I can address sleep apnea a little bit just because I have personal experience with that. My wife was telling me that she sensed that I was like stopping breathing, right? A lot. And so she bumped me and I'd start breathing again. So she wanted me to go get it checked out. And I don't take any pharmaceuticals. I'm very healthy in general. So I went to the pulmonologist and he, listened to my lungs and he, checked me over and, he says, you're really in good shape. I don't think you need to do a sleep apnea study, but if you want to, you can. I said, well, maybe my wife will feel better if I do it. So I went ahead and did it. And I brought the device back in there. And he said to me, he says, you've got one of the worst sleep apnea cases I've ever seen. Something like, I don't remember. It was a lot, huge number. And so he says, you really should consider getting a device. And I said, well, let me think about it. And I started doing my own investigation. So what I found out is that when my research is that the people who've died from sleep apnea had so much comorbidity going on. It's not like, you have this marathon runner who dies of a heart attack, it's people who have big time comorbidities, whether they're overweight, high blood pressure, diabetes, and then the sleep apnea can be a problem for them. So I just said, forget it. I'm not going to get the device. I'm just going to ride it out. And so I don't know. I've never, that was years ago and I haven't had any problems. And because the thing is, my breath stops so much. Well, I'm talking now, so I'm not breathing. I mean, this is an event here. Now I take a breath and then I'm going to talk some more and then I'm not breathing some more. And then there's another event here. So I don't know.
Well, two fun comments on it. One is when answering the questions, do you fall asleep during this time frame, that time frame, or not out? And to each and every one, which was documented, I didn't realize that until I looked at my portal. No, but my husband does. No, but my husband does. And this was 10 times. No, but my husband does.
Right.
And also getting back to some of the behavioral, the sleep hygiene. Now, sleep hygiene to me, I thought they meant I was dirty because I smelled, I had a shower, but I smelled like chlorine still because I had been swimming that day. So I'm a little itchy. And I'm watching TV that night too, because I always fall asleep to the TV when I'm alone. And I didn't. So that was another no-no.
Yeah, a lot of no-nos there.
No, I didn't realize it was a behavior approaching your sleep as well.
Yeah, sleep hygiene is really important. Super important.
I'm thinking, I'm not dirty. I've been in chlorine. I've taken a shower. I'm clean, So it had nothing to do with that other than, some very good practices leading up to that.
That's right. And Don, we had a discussion on that earlier as well. I think it was in part of our effective habits routine, and we talked about sleep, with the quantity, not the quantity and the quality, and how to approach it. So I think if people are interested in that, go back and find that as well by looking at Breck's TikTok profile and then finding the things.
I
And then
can't
on your-
tell you the difference. I cannot even begin to describe the difference. I'm like a reborn sleeper.
Yep, change
beautiful.
your whole
So
life.
much
Yeah.
happening.
Nice.
Your query on, I was racking my brain on your query on sleep apnea and the connection to, high blood pressure. I don't know if nothing that's, for lack of a better term, Dennis talked about the 24-hour rhythm type thing. And I remember my old martial art
Yeah.
instructor, very, very deep guy. There's a thing called dim mak that some people don't think exists, but he knows, but it's split up into a 24-hour period, and your body focuses, and it's really in clumps of 2 hours per day. Something that you do at one point of the day is healthy, another point is damaging. The strike in the one point of the day is only damaging, another point is death making. How do I tie in what you're saying? I can't necessarily think of anything else that's periodically that happens at night or happens during the day that is connected to hypertension. Maybe Breck or Bob can. But
And
Bob,
I have normal blood pressure.
yeah, and Bob alludes
I'm a 120 girl. Yeah.
Beautiful. Bob alluded to other things for other folks who aren't as normal as you on the other way. Obesity certainly plays in the factor. Breck talked about tobacco as instance.
Or maybe previous tobacco use also.
Right. Because that impacts the health of your arteries and things of that nature. Why I think the old term for high cholesterol did was called hardening of the arteries. Well, if you've got arthritis or other inflammation, or if you've got cholesterol, that'll harden the arteries, and that impacts it. So there are a lot of things that are associated with it, but I can't think of anything else that's periodic, like you talk about like the sleep apnea.
But I think,
Oh.
I think all of us have to take stock as if we're trying to maintain our automobile. I mean, I would put new brakes on my
Yes.
car. So I really have to
Yes.
we all have to sit back and be a journalist approaching the topic of what may be challenging our systems.
Right.
Yeah, absolutely. I think we did a whole series on pain, and we talked about, pain is the check engine light, right?
Yeah.
It's
right.
just saying something else is going on here. It's not that you actually have pain.
Right. I just wanted to mention one more thing, and that is the important, because I teach about future. First of all, I recommend all you save the chat. There's a 3 button. There's a lot of information in the chat. You can use the three dots at the top of the chat to save it. And I put my contact information in there. If anybody's interested in having further discussion about any of these topics, please contact me. What I wanted to talk about is future visioning, because I teach that with every client I have, because most people don't understand that their view of their future is corrupted by all the crap they're dragging with them from the past, right? And when I had that experience with the sleep apnea, what I did was, before I went to bed, is I had a little couple of sentences I said to myself, which was, hey, you're going to be breathing continuously throughout the night without any interruption, and just pausing your breath when it's appropriate. And I'd go through some of that before I went to bed. And then, 6 months later, no more sleep, no more interruption, no more wife saying, hey, you're not breathing, right? Future visioning is so important. People need to understand that they should be looking forward into the future for what they really want to have, even if they don't know how to produce that. And if we could teach that to our kids, that would be fantastic, So and everybody, in my opinion, should be exposed to what it means to have what I call a corrupt future vision. Is, well, I'll probably never get out of pain. I'll be taking high blood pressure meds forever. My blood pressure will always be high and on the borderline of out of control, and I just got to live with it. That's to me, that's a corrupt future vision. That's like, are you kidding me? Is that what you really want? Or do you want to be off your blood pressure meds? Do you want to be relaxed, peaceful, happy, healthy? What do you want for yourself, right? Anyway, that's enough about future visioning.
Good comments.
Yeah, just real quick, I was just going to thank Dr. Bob for mentioning to save the chat. I put a link in there as well as my contact information, but there's a health risk assessment that I invite everyone, totally free for you to take, and it literally can add a decade to your life. So if you can respond to those, there's like 19 questions, but the first 5 or 6, if you can respond to those correctly, It literally, there's studies that shows it will add, 8 years for men and 10 years for women to our longevity. So I know we have some longevity experts here. Take a look at that, and if you can't answer those questions correctly, then you probably need to contact us so that we can help you.
And when,
There
and
you
when you put that in there, Breck, where's the information go? How's it handled?
Yeah, so it's all HIPAA compliant, protected. It goes can be shared with you if you request it, but it's part of the Independent Pharmacy Provider Network, so IPPN, that offers that free health risk assessment, and it's shared with with your primary care provider and then the patient. So again, it's HIPAA protected and compliant. Once we have more of the wellness centers set up, that's the tool that we use for patient intake.
All right, great, appreciate it. So I want to thank all you that participated on TikTok, all of you here on Zoom with us, and people came off Facebook. Thank you for being with us and making this a kind of a stimulating conversation. I invite you to all come back again next week. I just put my email address in there. And for those on TikTok, it's tim@wellnesswaveclub.com. Again, tim@wellnesswaveclub.com. I put that in that because we want comments on how we can make this better, questions you might want to see addressed that weren't addressed on hypertension today, other questions and other topics you'd like to see us raise. And also, I know it's a long list, but give us people you think are doing a great job out there in helping people, like Dennis and Don with the Healthy Aging Show and some of the work that Diana is doing. Give us people who you think are doing great work in this whole space that we can reach out to some of them, and if they are like-minded, we can collaborate with them and help them and do a better job of helping America achieve the wellness that we want them to have. Thank you.
We have a
Awesome.
ways to go, don't we?
Yeah.
Yes, but yeah, thank you everybody for being here, and especially for everyone following on TikTok. Appreciate you being here. I will put this information that was provided in the chat. I'll make sure that gets put up on the Facebook group, Healthcare Disruptors Well Wave Now group. You can find that right here by going to my link in my bio. Click on the link tree, and you'll get right into the Facebook group where you can get all of the notes from today's session.